Have you ever wondered if there is something about your body that no blood test can explain? Most fertility evaluations begin with hormones, ovulation, and cycle tracking. But for a small number of women, the missing piece isn't found in their lab work. It is found in the way their uterus developed before they were even born. Today, we're talking about the condition many people call a heart-shaped uterus. What is it? Can it keep you from getting pregnant? Does it always require surgery? And why so many women with this diagnosis go on to have healthy babies while others face unexpected pregnancy challenges? If you're trying to conceive and you're looking for answers instead of more confusion, this episode is for you. Let's dive in. Do you long to get pregnant and trust your body again? Do you feel exhausted by the month after month cycle of hope and disappointment? Do you carry that creeping sense of failure? The fear that your body just isn't working the way that it should? If so, I'm so glad that you're here, my friend. Hi, I'm Mariana, a wife, mom, and a fertility care practitioner. After years of confusion and heartache, I learned how to understand my cycle with clarity and move towards pregnancy naturally by following a real system instead of guessing. This is Fertile Window Lab. If you're ready for real clarity about your cycle, a simple method that works, and less pressure from predictions, alarms, and fertility gymnastics, sit down the sticks, pop in your earbuds, and let's make sense of your fertility together. Before we jump into today's episode, I want to ask you something. Have you ever left your doctor's appointment with more questions than answers? Maybe you've been told you have PCOS, endometriosis, a heart-shaped uterus, or another fertility diagnosis, but no one has helped you understand what it actually means to your journey. That's exactly why I created a fertility clarity call. Trying to conceive shouldn't require you to become your own fertility detective late at night on Google, piecing together conflicting advice from social media, blogs, or forums. During our 1-hour call, we'll look at your cycle, your fertility signs, your health history, and your biggest questions so you can leave with greater clarity and better understanding of your next steps. No endless guessing, no information overload, just personalized guidance rooted in restorative fertility care. If that sounds like the support you've been looking for, you'll find the link to book your fertility clarity call in the show notes. Over the past decade of serving women and couples through fertility care, I have had the privilege of walking alongside many different infertility journeys. Not two stories are exactly alike, because not two bodies are exactly alike. Today's topic has to do with something we call structural differences, physical differences in the reproductive anatomy that can sometimes affect fertility or pregnancy. Now, that is not usually the first thing that is evaluated. In restorative reproductive medicine, we begin understanding the whole picture: the menstrual cycle, hormonal health, ovulation, the husband's fertility, and other common factors. But when the couple has worked through all those pieces and pregnancy still hasn't happened, the next step may be to investigate whether there is an underlying structural issue. Some physicians that I work with may recommend an exploratory laparoscopy, not because surgery is the goal, but because sometimes it is the only way to identify problems that blood work or imaging can't fully reveal. I know most women are not excited about the thought of surgery, and that's completely understandable. But time and time again, I've been amazed by what those procedures uncover. Sometimes it's severe endometriosis that has gone undiagnosed for years. Other times, it's a scar tissue, pelvic adhesions, blocked fallopian tubes, chronic inflammation, ovarian cysts, fibroids, or even developmental differences in the reproductive organs that no one suspected. For many couples, those findings become a turning point. Instead of continuing to wonder why pregnancy hasn't happened, they finally have answers. And with answers comes a treatment plan that is focused on restoring health whenever possible. One of the more surprising findings I have encountered, although it's uncommon, it is a heart-shaped uterus. That's the term many women have heard, but it's actually an umbrella term that can describe several different uterine shapes and developmental differences. And here's what's important. Not all of these conditions affect fertility in the same way. Some women conceive naturally without difficulty. Others are more likely to experience miscarriage or pregnancy complications rather than infertility itself. Understanding the difference is important because it helps guide the next steps and prevents unnecessary fear. So today, we are going to unpack what people mean when they say heart-shaped uterus, explore the different types, discuss how they are diagnosed, and talk about what restorative reproductive medicine considers when helping women navigate these structural differences. Let's begin with the most common type people think when they hear the term heart-shaped uterus, and that is called bicornuate uterus. Now, don't let the medical name intimidate you. Think of a typical uterus as being shaped like an upside-down pear. A bicornuate uterus has a deeper indentation at the top, giving the appearance of a heart with two upper horns. This happens very early in a baby's development, before she's even born, as the uterus is forming. It is estimated to occur in about 1 out of 200 women. So while it's not common, it is certainly not something I have only seen once in my practice. Here's the encouraging part that often surprises women. A bicornuate uterus usually does not prevent a woman from getting pregnant. Let me say that again, because it is an important distinction. Many women hear they have a heart-shaped uterus and immediately think, this is why I can't conceive. Sometimes that is not the case at all. One client comes to mind. She had worked so intentionally through her fertility journey. We addressed hormonal health, carefully charted her cycles using the Congenital model, and partnered with the restorative physicians to investigate every piece of the puzzle. When she learned that she had a bicornuate uterus, naturally she wondered if this was the reason she had a struggle. But it turned out that getting pregnant wasn't the biggest challenge. Staying pregnant safely was. She conceived naturally, not once, but twice. However, because of the shape of her uterus, both pregnancies required much closer monitoring. She was followed by a maternal fetal medicine specialist, often called a high-risk pregnancy doctor, because her uterus had less room for the baby to grow normally. Both of her babies arrived prematurely, but because her medical team knew about the uterine anatomy ahead of time, they were prepared to monitor carefully and intervene when necessary. That's one of the biggest lessons I took from walking alongside her journey. Knowledge doesn't create the problem. Knowledge creates the plan. Many women imagine that once they see those two pink lines on a pregnancy test, every fear disappears. We all hope for a smooth pregnancy, but sometimes pregnancy brings unexpected challenges. And knowing about structural differences before those challenges arise allows healthcare team to prepare instead of reacting. That knowledge can replace panic with purpose. And trust me, you do not want to be panicking when you're pregnant. If you've been told you have a bicornuate uterus, don't assume the story ends there. Instead, ask better questions. How is this diagnosed? Was it confirmed with imaging such as a 3D ultrasound or MRI? Do I need another medical evaluation to make sure this is another type of a uterine anomaly? If I become pregnant, what kind of monitoring would I be recommended? In restorative medicine, we don't stop at naming the diagnosis. We want to understand what it means to your fertility, your pregnancy, and your long-term reproductive health. Because the goal isn't simply getting pregnant. The goal is helping both mom and baby thrive through pregnancy and safely into birth. And this brings us to another condition that is often confused with bicornuate uterus, a septate uterus. On imaging, both can sometimes appear heart-shaped, but they're actually very different. A septate uterus has a wall of tissue called a septum that divides the inside of the uterus. Think of it like having a room with extra wall running down in the middle. From the outside, the uterus may look almost normal, but in the inside, the extra tissue creates two separate spaces. Why is this important? Because the tissue in the middle often has poor blood supply. If an embryo implants on the septum instead on the healthy uterine lining, it may not receive the support it needs to continue developing. That is why a septate uterus is much more strongly associated with recurrent miscarriage than difficulty becoming pregnant. And this reminds me of one of my clients from my very first year working in fertility care. Her journey was anything but simple. Before coming to us, she had already been diagnosed with PCOS. Her husband also had male factor infertility. And as we continue her evaluation, she was treated for endometrial infection, and polyps were also discovered and removed. On top of all of that, she had experienced the heartbreak of repetitive miscarriages. If you ever felt like every appointment uncovers another problem, you probably know the emotional way of wondering, will we ever get to the end of this? I have walked with many couples through that frustration. Sometimes progress feels painfully slow because restorative medicine isn't about finding one magic answer. It's about patiently uncovering each factor that may be standing in the way of a healthy pregnancy. As her treatment progressed, additional imaging reveals something that hadn't been recognized before: a septate uterus. She underwent a minimally invasive outpatient procedure to remove the septum. Within just a couple treatment cycles, she became pregnant. She carried that baby to full term with very few complications. And the story didn't end there. She went on to have 3 more healthy, full-term pregnancies without needing another surgery for a septum or interventions. I love sharing stories like hers because they remind us that healing often happens one piece at a time. Every diagnosis wasn't another reason to lose hope. It was another opportunity to address the real problem. If you have experienced repetitive miscarriages, especially when no one has been able to explain why, it may be worth asking whether your uterine anatomy has been carefully evaluated. And this is why the type of imaging matters. A standard ultrasound doesn't always tell the whole story. Sometimes a saline sonogram, a 3D ultrasound, or an MRI is needed to distinguish between the heart-shaped uterus and a septate uterus, because although they may look very similar at first, the treatment is very different. Unlike the bicornuate uterus, a septate uterus can often be corrected with a minimally invasive outpatient procedure. For women whose miscarriages are related to the septum, removing the tissue may significantly improve the chances of carrying a pregnancy to term. An accurate diagnosis is key. Before assuming there is nothing that can be done, make sure you know exactly which uterine anomaly you have, because the path forward can look very different depending on the diagnosis. The last type I want to mention is called arcuate uterus. Of the 3 we have discussed today, this is the mildest form, and in many cases is considered a normal anatomical variation rather than a true abnormality. Instead of a deep heart shape or a wall dividing the uterus, an arcuate uterus has only a small, smooth indentation at the top of the uterine cavity. Most women never know they have one unless it's discovered during an ultrasound, MRI, or another imaging study for an unrelated reason. Unlike the other conditions we have talked about today, an arcuate uterus usually doesn't require treatment or surgery. I'll be honest, I haven't personally cared for a client whose fertility challenges were caused by an arcuate uterus. In fact, that's part of the point. Sometimes we find difference in anatomy that looks concerning on paper, but don't actually interfere with women's ability to conceive or carry a healthy pregnancy. This is also a good place to clear up another common source of confusion. Many women are told they have a tilted uterus, also called retroverted uterus, and immediately begin wondering if that's why they haven't gotten pregnant. A tilted uterus is not the same thing as a heart-shaped uterus. It is simply a uterus that tilts backwards instead of forward. And it's actually very common. About 1 in 5 women have one. The overwhelming majority of women with a tilted uterus conceive naturally, carry healthy pregnancies, and deliver healthy babies. So if you've been told you have a tilted uterus, I don't want you to leave this episode thinking you have found the explanation for your infertility. Most of the time, it isn't. Growing up in a Mexican family and now serving many Latina women, I have also heard of the old saying about la matriz caída, or a fallen uterus. There are many cultural beliefs surrounding fertility. And I always encourage women to distinguish between family traditions and evidence-based medicine. Some women have heard recommendations like laying in certain positions after intercourse, or seeking abdominal massage to reposition the uterus. While these practices are commonly discussed, we don't have a strong scientific evidence that this can improve fertility. So if you're considering any type of manual therapy, especially one involving the reproductive organs, it is important to discuss it with your physician First, to be sure it's appropriate and safe for your individual situation. So how do we approach all of this if you've been told your uterus is different? First, don't panic. Second, ask for clarity. What exactly is the diagnosis? Is it a heart-shaped uterus? Is it a septate uterus? Is it arcuate uterus? Or simply a tilted uterus? Those are 4 different findings, and they don't all have the same impact on fertility or pregnancy. Finally, remember this. The purpose of a diagnosis is not to label you, it's to guide your care. I have seen women with bicornuate uterus become mothers. I have seen women with septate uterus receive treatment and go on to build beautiful families. And I have seen countless of women worry about tilted uterus when in reality, those findings weren't preventing pregnancy at all. Your uterus might not look exactly like the textbook illustration, but that doesn't mean your story can include healthy pregnancies, healthy babies, and hope. And that's why restorative reproductive medicine takes the time to understand the whole person, not just one image, one diagnosis, or one test result. And if today's episode left you thinking, I wish someone can help me understand my specific situation, remember my fertility clarity call is there exactly for that. You'll find the link in the show notes. Thanks for being here. Keep asking good questions, keep seeking answers, and don't lose hope. Un abrazo. I'll talk to you soon.
I'm my mama's little fertility helper. If this episode has helped you, or if you feel a little more hopeful, leave a review. She'll love it.
Hi, DTC Warrior. I hope you enjoyed today's episode. If so, please leave a 5-star written review on Apple Podcasts. It truly helps to get this show into ears of more women who need it. And be sure to sign up for my weekly encouragement, tips, and insights straight to your inbox. I promise to keep it practical, hopeful, and faith-friendly. All right, I'm off to tacos, chocolate, and turn my cycle. I'll meet you back here next week. Bye.